Big, small, spiders, seen and unseen, we all have veins in our body. If you look at them, you can see them all throughout your extremities of your body. Almost every day at work, I start anywhere between 10 and 30 IVs a day. Outside of work, I have to resist the urge to tell strangers they have great veins for starting IVs. IVs are a very common procedure that nurses should know how to do, especially within the hospital setting and the patient care setting. According to page 11 of the Texas Monthly, without IVs, nurses would have to turn patients into pincushions, sticking them a dozen times a day in a dozen different places. The Texas Monthly goes on to say, for a hospital nurse, starting an IV is a daily chore, but it is one that many never master. Therefore, today we will identify what an IV catheter looks like and the sizes. Then we will go step by step on how to master the IV. This here is an IV catheter. Just make sure you can see it. That is a 22 gauge. I will be taking it out. You'll have a better visual of this. Okay. This is a 22 gauge. They have an 18 gauge, and an 18 gauge is bigger. There is a 20 gauge, which is bigger. Then there's a 24 gauge that's smaller, and they have other different gauges. The lower the number, the bigger the needle. The higher the number, the smaller the needle. So, outside of the package, this is what an IV catheter looks like. And a better view. Okay. So, I'm going to put this back in this cap here. This is a tourniquet. What we call a tourniquet. Okay. So your first step, I'm going to use the teddy bear today. Alright. This is going to be my patient. We will lay them down. Normally, if they are a hard stick, you're going to lay them flat. Or put them in the best position. Whichever position you have, if you have them flat, you can droop the arm if you're trying to get a vein here, and the blood will flow through to that, okay? That is for what we call a harder stick. Veins that are unseen, spider veins, whatnot. However, if you're trying to get them in the legs, you want to dangle the legs and have them lay down. But today we're going to use the bear sitting up. So, you wrap the tourniquet 3 to 4 inches above the site that you're going to be doing that IV. So we're going to wrap him. Just trying to get it in a better view for y'all to see. We're going to wrap it right here. Okay. So our tourniquet is wrapped. Alright. I'm going to make an IV insertion about right here. Okay. So, what we're going to do, when you take your catheter, you're going to make sure that the bevel, let's see if I can get this. Your bevel is going to be an open little end right there, that little stick. Okay, so you're going to make sure that's faced up, okay? And when you go in, you're going to put it at a 30 to 40 degree angle. You also want to make sure that the vein is straight as it can go, that you can palpate the vein. So if you are going to use this, you're going to start it. You're going to go at a 30 to 40 degree angle, not quite 50. You're going to go into the vein, and you come back up, go straight. Say I have a flash of blood there. You're going to pull the catheter up. First, you're going to advance it 1 to 2 millimeters more. You're going to pull that catheter up and pull the needle out. And now you have a catheter. But then you're going to want to put pressure right here so you don't have blood. And then you're going to pop that tourniquet. Okay? And then after this, you're going to obviously tape it and hook your tubing up to it and then start your fluids, whatever you're doing. And that there is your IV needle in that. So today we identified how to start an IV and the different size of IV catheters. When I go to start an IV, I think of the extremity of the body I'm using as a road map, and the veins are roads that you have to follow. Just remember to stay with the vein, don't go too deep, and follow the direction of the veins. Nurses in patient care settings should have a knowledge of starting an IV. And if you're watching this, I assume you're learning or needing tips. Just don't give up. You will master it after tries, if not at the first try. Now, once you arrive at your goal, this is the starting point to another goal.